everyone. It is Jessica Seville from the Kidney RD. I'm coming in here today. This week is Potassium Week. Last week we talked about low protein diet, but today and all of this week we're going to talk about potassium. Is a huge topic and one that a lot of people have questions on. If you don't know me, I am the owner of the Kidney RD. We're a private practice of renal specialized dietitians who help people preserve their kidney function. Okay, so a few things on potassium basics. And again, come in here every single week. You can hop onto my Facebook page and watch any of the past videos or go over to my YouTube channel. Very basics. First off, what is potassium? Potassium is a mineral. It's something that is used in our body for all sorts of functions: nerve function, muscle function, heart function, all sorts of things. It's a really, really important nutrient. So then the question is, why is it such a big deal for kidney disease? So the reason it becomes a big deal in kidney disease is if you are later stage kidney disease or on certain blood pressure medications, then it can be really hard to process out that potassium, which can cause the levels in your blood to get too high. When your body gets overloaded, too much potassium in the blood, then you get something called hyperkalemia. That's a kind of just a very short-term event. For some people, they can end up in the hospital. So, of course, that sounds scary to people. They don't want to end up in the hospital. They don't want to have hyperkalemia. So here's the important part about it, though. Just because you have kidney disease doesn't necessarily mean you have to cut out potassium, and doesn't even necessarily mean that you are really high risk for getting too much potassium in your blood. Potassium doesn't hurt your kidneys. That's a really important distinction. It doesn't hurt your kidneys to have foods with potassium. The problem really is when you get too much potassium and it builds up. So the important thing is that you're looking at your labs, you know where your potassium is running at, and if you don't need a restriction, then don't worry about it. If you do, your doctor should tell you, or you should be monitored by a dietitian who also can guide you. All right, so it's an important mineral. It's also really helpful for keeping your blood pressure low and lower. So if you don't have to have a potassium restriction, then don't worry about some of the higher potassium foods. All right, number two. Man, I jumped ahead. My second point was not everybody needs to have a low potassium diet if you have kidney disease, but I've already covered that. So we're good. You know that. It's all run by your labs. That's what the national guidelines even state that are being released this year from the KDOQI, which is the kidney disease outcome quality indicators. Okay. So a couple things. People like to know, what are the high potassium foods? It's pretty easy. If you Google them, you can find a lot of them. The common ones that come up are potatoes and tomatoes. Winter squashes like pumpkin or butternut squash can show up a lot as high potassium foods. Bananas, oranges show up all the time, and melons can also show up a lot. Those are some of the high potassium foods. People with a potassium restriction that need to watch potassium, it's a good idea for them to be aware of where these high potassium foods are. I'm going to drop a link below to a list where I have some high potassium foods. You can also download it. Some high potassium foods that get confused because you'll see them on low potassium lists and high potassium lists, and that's really confusing. The reason that happens is that different lists will decide what is their parameter for high and low potassium. So some will say 250 milligrams per serving. Others will say 200, some say 150. And so that's why you'll see some foods kind of shift between low and high lists. Broccoli is one that gets confused a lot. It'll shift between high and low. It's kind of on the medium side. So that's one that I see on both lists. For us, we say a low potassium food is any food that is less than 250 milligrams per serving. But broccoli is one that I feel like gets really, really confused a lot. And for us, it's something that we include in a diet, even with a potassium restriction. Okay, so low potassium foods. There's lots of amazing low potassium foods out there. Any of your berries, strawberries, blueberries, blackberries, if you're in Texas, dewberries, any berries will work. Cherries, Let's see. Watermelon actually is a low potassium food based on your serving size. Most of us still only eat a half a cup, which is why it can tend to show up on high potassium lists sometimes. Rice, apples, carrots, green beans, peppers, onions, garlic. All of those are good low potassium foods. There really are an enormous amount. But again, I will drop a link down below with a few options there so you can look at it. One great idea if you're trying to, kind of filter out some things in your diet is I like to have my patients go to supercooks.com and they'll enter in a few foods that they are trying to take out. And then they can find some recipes that don't have those included. Or they can work with one of us. We have a pretty awesome meal planning database where we can help people plan out some meals and ideas so they can get the nutrition that they need and find some good options. Anyways, that's all for now. I'm here Monday through Thursday, clarifying the kidney diet, making sure that people have good information, the information that as dietitians who are expert in this field, this is what we are using to provide recommendations and guide our clients to get fantastic outcomes. You can follow me on Instagram. You can follow me on YouTube. Any of those places, I post videos and information for people with kidney disease so they can find kidney health. All right, that's it for now. Thanks so much. Bye-bye.